The article I will be discussing today was published in the Journal of Nursing Management in 2011. The authors discuss a study that was performed showing a nursing staff perspective about the assessment of individualized care in older people in inpatient care settings. It shows that nurses assess individuality in care to some extent. Although individualized care has been part of the national health care policy for some time, studies about the realization of individualized patient care from different perspectives are limited. The research study was done in 2008 in 4 randomly selected long-term inpatient hospital wards in Finland. Surveys were handed out anonymously to 96 RNs or LPNs with a response rate of 65%. A statistical analysis was completed on the data. The results of this study demonstrated that nurses perceived that their interventions and the care they provided were individualized. However, the findings suggest that the nursing care actually provided was based around routines in the organization and was therefore system-oriented rather than patient-oriented. This finding is in line with other research which suggests that in care settings for older people, nurses focus on reacting to problems rather than proactively creating an environment that facilitates comfort. Putting these two findings together, it appears that nurses' perceptions of the care delivered is not necessarily what takes place as perceived by patients. Nurses felt they were good at taking patient individuality into account in the clinical situation. However, the findings of the study suggest some problems in the actual delivery of individualized care. Some of these explanations include longer periods of care decreases patients' decisional control. Older patients may have cognitive deficits, making it difficult to participate in the decision-making process. Another issue that was discovered is that nurses did not actively encourage the patient's family to take part in the family member's care. And lack of quality interaction between nurse and patient suggests a communication barrier. Also, the existence of other barriers, such as those resulting from inflexible ward routines and organization systems, are major hurdles. More than ever, nurses report that they are practicing in situations where there is a lack of congruency between individual patient needs and the demands of the organization. Individualized care demands the development of relationships with older people and their families. Suggestions for the development of individualized care include improvement on the quality of interaction, support of the older people's families to participate in the care of their relative, and a closer examination of organizational structures, care environment, leadership styles, and care processes. There is also a need to provide education and training opportunities for nurses to improve upon their knowledge and communication skills with the older patients.